Can you talk to us about the procedure?
Sure.
How invasive is it? Paint the picture for us.
Well, I mean, the procedure is a laparoscopic procedure where we put the scope in small little incisions along the abdomen. It is invasive. It's real surgery. You definitely, you go under general anesthesia for this because we are taking a small organ out of the body. Basically, we make a little incision about a little bit bigger than a centimeter by the belly button where we try and hide it, large enough to put a scope in that's about the size of a pen. We make 3 other little incisions in the upper abdomen for small instruments, and then we tease out the gallbladder, we remove it, technical issues, and put it into what looks like a little cinch purse, and then I weasel out the belly button, or any other surgeon does, and we put the scope in at the end of the case, and we double check that, as every surgeon does, to make sure there's absolutely no bleeding, everything looks well before we leave. That's the basics.
And this procedure is a cholecystectomy?
Yes, definitely. It's called a laparoscopic cholecystectomy. It can also be done open, but it's not the overall standard of care nowadays. About 99% of these procedures are done laparoscopically.
And when you say laparoscopic, you mean?
With the camera and the small little instruments, as opposed to the old-fashioned, which is a traditional incisional type of surgery.
Very much less invasive in terms of
much better.
Exactly. Recovery is pretty good. How's the recovery look like?
Most of the patients get admitted to the hospital for a 23-hour stay, or essentially overnight. We usually do it in the morning, first thing. Usually these are elective cases if we can help it. And we do the case, they go to the floor, they're watched by the nurses in the hospital, and then we make sure they can tolerate food, because if you can't eat, you can't go home. And in the next morning, usually they're on their way home.